First up, a story you'll only see here on News 5 tonight. And for those working at the El Paso County Coroner's office, there's no avoiding the harsh realities of the COVID-19 pandemic. Before we tell you about a new challenge they face, a warning tonight. If you recently have lost a loved one, this story may be hard to watch. Our Colette Bordelon joins us live tonight to explain what the coroner says feels like a betrayal here, Colette.
Yeah, here at the coroner's office, their job is to investigate any sudden or unexpected deaths or those considered a public health risk. The COVID-19 pandemic would fall into that category. But just within the last couple of weeks, this office has fielded a few calls from family members demanding the coroner remove a COVID diagnosis from their loved one's death certificate. A request for our coroner to commit a crime, he says, is fueled by conspiracies. Walking into this room,
Mondays are our busiest days.
you can feel the weight of this job.
This is a very, very hard job.
But Dr. Leon Kelly, the El Paso County Coroner,
A record-setting year in many, many ways, unfortunately.
has worked his entire life to get here.
It's disheartening, it's demoralizing, and it's exhausting.
In the last week, his office has had at least 3 families demand they remove the COVID diagnoses from their loved ones' death certificates, saying those in the office make money off of COVID cases.
That is not true. That is a lie.
He says on any death certificate, there's a place for the primary cause of death, in these instances, COVID or COVID complications, but any underlying conditions are still recorded.
Death certificates aren't being filled out any differently than they have for the last 100 years.
And if Dr. Kelly went ahead and changed a death certificate because of a family member's demands, that would be a crime.
The job of this office isn't to make people feel good. It's to put the truth on that death certificate. The truth is the only way we're going to get to preventing similar deaths in the future.
He says his office is trained to handle grief and knows they signed up for high-stress situations. But this added layer is a lot to take.
And then to have people call the office claiming that we're lying or we're making this up, it does feel as if really a great betrayal.
And he says it all starts with conspiracy theories.
And as we saw in the nation's capital this last week, those lies, that misinformation has real world ramifications.
Because this may be their biggest challenge yet.
The sacrifices that we've all made, to then have that turned around and say, despite you really being the heroes of this story, we're going to make you the villains because we don't like what you have to say.
At an office that faces death every day.
Just please treat us as human beings.
Now, I did also talk to Penrose St. Francis today. They told me doctors or nurses never get any extra pay for a COVID case. What does happen is Medicare will pay the hospital a little bit more for that care, but the hospital as a whole makes no money off of COVID patients. Always watching out for you, El Paso County. Colette Bordelon, News 5.